So just as one gets healing of wounds, the liver, when it's damaged, there is increasing scar tissue formation, and it's usually driven by inflammation-based processes. But over time, the scar starts to become more organized. We call that fibrosis, and one progresses to more and more higher grades of fibrosis until it's very organized. And that organized scar tissue in the liver is what we define as cirrhosis, where there is increasing impairment of not only function of the liver because one walls off zones of the liver, but also it impacts on things such as the blood circulation and flow going through the liver. It also impacts on the function of the liver from the point of view of things such as the immune system. So it has a number of different effects. So cirrhosis is driven by many different etiologies. In the Western world, the most common causes are alcohol-based liver injury. Certainly in the UK, we probably see 60 to 70% of the cause of cirrhosis at the moment driven through alcohol. However, increasingly, obesity and what we call complications of metabolism, such as diabetes and obesity together, drive fatty deposition within the liver, and that in turn, fatty liver disease, has an increasing impact on progression to cirrhosis. And we're beginning to see that certainly, of course, the last decade or so, and the projected data for the growing numbers of patients with diabetes and obesity means that I think this population of patients with cirrhosis caused by fatty liver will just increase substantially over the course of the next decade or two. And finally, there are many other causes, much smaller numbers now, which include things such as viral hepatitis, if it's left untreated. Fortunately, for most of the common viral hepatitis, like hepatitis C and B, we now currently have treatments, and certainly for hepatitis C, there is a very effective treatment. So whilst historically that was a significant subset of patients with cirrhosis, fortunately moving forward, I think that number will drop, though there are still patients who historically had progression caused by the untreated virus, which has caused them to have cirrhosis. And there are many other smaller, more minor causes, including some types of inflammatory liver disease, we call autoimmune liver diseases, and things related to increase in deposition of, say, iron, for example, in the liver. So this is actually a very difficult one for patients, because some patients with cirrhosis in their early stage will have no symptoms at all. And that's the danger, if you like, because if it goes unchecked, they can often end up presenting for the first time when they already have very advanced disease. And it's in fact quite common to have no symptoms at all. As the disease progresses, the common sort of presentations may include the development of jaundice. It may include the development of fluid on the body, most commonly seen within the abdomen, so seeing abdominal swelling caused by fluid, or increasing swelling of the legs. And there are many other additional complications that may be the presentation in terms of symptoms that individuals come to the hospital or see their primary physician with. I think the most common presentation of cirrhosis is actually development of fluid, seen most frequently in the abdomen, but also on the lower limbs, and patients are unclear why that suddenly occurs, but it's what often brings them up to the hospital. This is maybe even up as many as 50% of the patients who present with cirrhosis-related complications. Another very common finding, probably in about 30 or 40% of patients, is changes in their higher brain function, what we call a syndrome of encephalopathy. This means that the patient can start with just a little bit of confusion, or just not being as effective at performing daily tasks or their work, and it can progress to the point where patients become increasingly sleepy or even comatose. Other complications include the risk of bleeding. So with the advancement of cirrhosis, there are increasing complications in the blood flow that goes through the liver, and there is a process of shunting of blood, which goes through very thin-walled vessels, but under higher pressure than would normally be the case. And as a consequence of this, they often bleed from the gut, presenting with either vomiting of blood or passing blood from below, and as a consequence of which, a significant subset come as their first presentation to the hospital with bleeding. And finally, there are other interactions of the liver with organs such as the kidneys. And so kidney dysfunction is also not infrequently seen, especially when patients develop infections, which is also much more common with cirrhosis. Cirrhosis management in the main is trying to see if one can prevent the onset of complications. So we go from a state of so-called compensated cirrhosis, where patients are ambulatory, often being reviewed in the clinic, and are sometimes still able to maintain a regular job, to a state of what we call decompensation, where they develop many of the complications we've just discussed and are usually impaired to the point they are unable to carry on working and have a significant quality of life. So really our job is, when patients have already got cirrhosis, is to stop that evolution to the state of decompensation. Once patients present with decompensation, then the real goal is to try and stop them progressing further still, because many will continue to deteriorate to the point where their liver will no longer stand them, and they either will require a need for a new liver, i.e. a transplantation, or they succumb to their disease. So it's really depending on the stage of which the patient presents as to what the challenges are. In terms of treatments, there is no specific treatment for the condition of cirrhosis per se, but increasingly what we're trying to do is to try and prevent patients evolving into this state of decompensation. And recent advancements in our knowledge of managing cirrhosis have given us a lot more insight into where the pathology arises. And we know that inflammation is important. We know that the movement of bacteria from the gut and the drivers for inflammation are there. And I think new treatments that will come online in the next years will particularly target these sources of inflammation and the gut to try and reduce the progression of the disease.